The man in the wrinkled gray t-shirt collapsed against the wall of the emergency room waiting area at exactly 10:17 on a bright Tuesday morning. His hand pressed hard against his chest. Sweat rolled down his temples despite the cool air conditioning. Around him, people stared for a moment before looking away. A receptionist pushed another clipboard toward him without lifting her eyes. What nobody in that crowded hospital knew was that the exhausted, uninsured patient sitting alone in the corner was worth nearly $3 billion. And before the sun set that evening, one nurse's simple act of compassion would change more lives than any business deal he had ever signed. Before we continue, if you believe kindness still matters and that everyone deserves a second chance regardless of their appearance, please take a moment to like this video, share it with someone who needs hope today, leave a comment, and subscribe to Kindness Hub for more heartwarming stories that remind us of the good still left in the world. For 15 years, Alaric Voss had built one of the largest healthcare technology companies in the country. His company created patient management software used by hundreds of hospitals. Investors admired him. Business magazines celebrated him. Industry conferences paid enormous fees just to have him speak for an hour. But success had created a wall around him. Every meeting he attended was carefully staged. Every hospital visit was announced weeks in advance. Every executive presentation came with polished tours, prepared statistics, and smiling employees who knew exactly what to say. Whenever Alaric asked executives whether uninsured patients received fair treatment, he always heard the same reassuring answers. Every report looked perfect. Every metric suggested success. Yet something felt wrong. Letters occasionally reached his desk from patients describing endless waits, ignored symptoms, and feelings of humiliation after revealing they had no insurance. His executives dismissed those stories as rare exceptions. Still, Alaric could not shake the feeling that numbers on a spreadsheet rarely told the whole truth. 3 months earlier, he had quietly begun visiting hospitals that used his software. He wore old clothes, used a false name, and removed every sign of wealth from his appearance. He wanted to understand what ordinary people experienced. What he discovered disturbed him. Staff members often seemed overwhelmed rather than uncaring. Long shifts and impossible workloads had drained their empathy. Patients without insurance frequently waited longer. Assumptions were made within seconds based on appearance alone. But that Tuesday morning was never supposed to become personal. Alaric had arrived at North River Medical Center wearing faded jeans, worn sneakers, and an old jacket. He planned to spend an hour observing the registration process. Then the pain started. At first, it felt like indigestion. Within minutes, it became something far worse. A crushing pressure spread across his chest and climbed into his shoulder. For the first time in years, fear replaced control. The receptionist asked for his insurance information. When he explained that he had none, her expression changed almost imperceptibly. He was handed forms. Questions came before concern. The waiting room was crowded, and Alaric understood that hospitals struggled under immense pressure. He tried to remain patient. But the pain intensified. Minutes stretched into nearly an hour. Twice, he approached the desk to explain that something felt seriously wrong. Twice, he was asked to sit back down and wait. The room blurred around him. Televisions played daytime talk shows no one watched. Phones rang constantly. Families whispered anxiously. Nurses hurried past carrying clipboards and medical equipment. Everyone seemed busy. No one seemed to see him. Then one person did. Her name was Maren Hale. 34 years old, with tired eyes and her dark hair pulled into a loose ponytail, Maren had already worked 3 consecutive 12-hour shifts. She carried the invisible exhaustion common among nurses who cared too deeply for too long. Years earlier, her father had died from a preventable heart condition after delaying treatment because he worried about medical bills. Ever since then, she had promised herself that no patient would feel invisible if she could help it. As she crossed the waiting area, she noticed something others had missed. The man's skin color had changed. His breathing had become shallow. His left hand trembled against his chest. Most importantly, his eyes carried the unmistakable look of someone trying desperately to stay conscious. Maren knelt beside him immediately. She asked simple questions. When had the pain started? Could he describe it? Did he feel dizzy? His answers confirmed her fears. Training took over. She called for immediate assistance and insisted he be moved to triage without delay. Someone reminded her that several patients had arrived before him. Maren refused to back down. She explained calmly but firmly that chest pain combined with his symptoms required immediate evaluation. Rules mattered. Protocols mattered. But people mattered more. Within minutes, Alaric was connected to monitors. Tests began. The results confirmed that he had experienced a significant cardiac event. The emergency physician later admitted that another 30 or 40 minutes of waiting could have led to devastating consequences. As specialists worked around him, Alaric watched Maren move through the chaos with remarkable focus. She never asked about his job. She never questioned whether he could pay. She never treated him like a burden. She treated him like a human being. That simple difference overwhelmed him more than the diagnosis itself. During the following hours, he remained under observation. Maren checked on him whenever she could. She explained procedures in plain language. She brought extra blankets without being asked. She reassured him during moments of fear. When she noticed him staring silently through the hospital window at the bright afternoon sky, she sat beside him for a brief moment. Not because she had extra time. Because she understood that fear feels heavier when carried alone. Alaric learned pieces of her story throughout the day. She was raising her 12-year-old son, Rowan, by herself. She often picked up extra shifts to cover expenses. Despite years of experience, she still drove an aging car with over 200,000 miles on it. Recently, budget cuts had reduced staffing levels, making every shift harder. Several colleagues had left healthcare entirely. Yet Maren stayed. Not because it was easy. Because she believed compassion was a responsibility. Late that afternoon, while reviewing his chart, Maren noticed the patient had listed his occupation simply as consultant. She smiled at the vagueness. Titles never interested her much. Character did. Meanwhile, Alaric wrestled with difficult emotions. He had spent years discussing healthcare innovation from conference stages and boardrooms. He had celebrated efficiency improvements and revenue growth. Yet none of those achievements mattered during the frightening moments when he sat alone in that waiting room. What mattered was one exhausted nurse who chose empathy over assumptions. For the first time in years, Alaric understood healthcare not as an industry, but as a series of human moments. Moments when people are frightened. Moments when dignity matters. Moments when compassion can save a life. The following morning, after receiving treatment and clearance for discharge, Alaric asked whether Maren could stop by his room before he left. She entered carrying discharge paperwork, expecting routine questions. Instead, she found him sitting upright, wearing a pressed navy jacket someone had delivered overnight. His posture had changed. So had the atmosphere. Alaric thanked her sincerely for believing him when others had not. Maren simply nodded. Helping people was her job. But Alaric explained that she had done far more than that. She had reminded him why healthcare existed in the first place. Then he handed her his business card. At first, she thought there had been some mistake. Her eyes moved from the card to his face and back again. The name was unmistakable. Alaric Voss. Founder and Chief Executive Officer of Voss Meridian Health Systems. The same company whose software filled computer screens throughout the hospital. Shock spread across her face. Not because he was wealthy. Because she suddenly realized how easily she could have treated him differently if she had known. Alaric told her that was exactly the point. Compassion that depends on status is not compassion at all. Over the next several weeks, changes began quietly. Alaric launched a comprehensive review of patient intake procedures across every hospital network using his company's systems. He invested millions into new training programs focused on empathy and equitable care. His software was redesigned to prioritize symptoms rather than insurance status during triage alerts. Anonymous patient feedback systems became mandatory. Staff wellness initiatives expanded to address burnout. Most importantly, hospitals received additional support to reduce wait times and improve staffing ratios. When executives questioned the expense, Alaric shared his experience. Not as a billionaire. As a frightened patient who nearly became another statistic. North River Medical Center later recognized Maren for her exceptional care, though she remained uncomfortable with attention. She insisted countless nurses performed similar acts of kindness every day without recognition. In many ways, she was right. Heroes often wear ordinary uniforms. They show up exhausted. They carry invisible burdens. They continue caring anyway. Several months later, Alaric returned to the hospital. This time, everyone knew who he was. Reporters gathered outside. Executives prepared speeches. But Alaric ignored the cameras and walked directly to the emergency department. He found Maren finishing her shift. Together, they sat briefly in the waiting room where their paths had first crossed. Sunlight streamed through the large windows, filling the space with warmth. Patients came and went around them. Life continued as usual. Alaric thanked her again, but this time his gratitude carried deeper meaning. Because saving a life involves more than medicine. Sometimes it means reminding someone what truly matters. Sometimes it means choosing compassion when nobody is watching. Sometimes it means seeing humanity where others see inconvenience. And sometimes, one act of kindness creates ripples that reach farther than anyone could imagine. If this story touched your heart, please take a moment to like this video, share it with someone who believes kindness can change the world, and subscribe to Kindness Hub so we can continue sharing stories that inspire hope and compassion. Special request: comment below with the words, "Kindness sees what others miss," if you believe every person deserves dignity, no matter their circumstances. As Alaric left the hospital that day, he paused near the entrance and looked back at the busy emergency room. People hurried past carrying worries no one else could see. Some faced financial struggles. Some carried grief. Some fought battles hidden behind tired eyes. And among them walked nurses like Maren Hale, ordinary people performing extraordinary acts of compassion every single day. The world changes in many ways. Through innovation. Through leadership. Through success. But lasting change often begins with something much simpler. One person choosing to believe another person's pain is real.